Thanks for joining us for KSAT News at 9. I'm Courtney Friedman. Here's a look at what's coming up tonight. The COVID-19 pandemic has forced funeral home owners to change the way they operate. Texas Governor Greg Abbott is extending school closures across the state, and the pandemic causing extra stress for those battling life-threatening diseases. We'll hear from a local cancer patient who hopes the public does its part and continues to social distance. But first, 3 more people in Bexar County have now died as a result of COVID-19. That brings the total number of local deaths to 9 so far. The number of total cases in our area has reached 207. Of these, 63 are travel related and 63 are community transmitted. City officials say 69 patients have been hospitalized, 32 of those are in intensive care, and 28 are now on ventilators. At least 44 patients have made a full recovery so far. Statewide, about 43,000 Texans have been tested for COVID-19. 3,200 of those tests have come back positive. At least 41 people have died from complications. At a press conference today, Governor Greg Abbott issued a new executive order telling Texans to stay inside if they can and limit social gatherings and in-person contact with people outside of their homes. He extended social distancing guidelines through April 30th.
At a time when lives are literally at risk, Texans continue to rise to the occasion. The efforts of Texans across the entire state have slowed the spread of the coronavirus. But, as the President has made clear, we are not yet done with our response. We cannot forfeit the gains that we have already made by cutting short our task.
The governor stopped short of issuing a statewide shelter-in-place order. Abbott's order also extends school closures until at least May 4th. Let's take a look now at the numbers across the country and across the world. Nationally, the U.S. has more than 185,000 cases and more than 3,500 deaths. Globally, there are more than 850,000 cases and more than 42,000 deaths. This global pandemic has created a new normal in communities all around the world, and it's forcing businesses to adjust, including the funeral industry. Here at home, Porter Loring Mortuaries is changing the way services are conducted and even offering live stream options. Tiffany Huertas has the story.
Obviously, it's a painful time when you lose someone, but it's even more painful when you add COVID and when you add the restrictions on top of that.
President of Porter Loring Mortuaries says they are following CDC guidelines amid the coronavirus pandemic.
Making sure that services do not exceed 10 people, which include our staff as well as the minister.
Helen Loring Deer says they are also coming up with different options for families who have lost a loved one, including having people pay their respects from inside their vehicle.
We will have their loved one placed in the casket outside under a portage, where families can gather no more than 10 near the casket, but also we can allow passerbys to drive by in their vehicle.
They have also implemented a program called From My Heart to Yours. People not attending the service can upload a photo of themselves and leave a message of support for the family.
We're going to print those pictures off with a message on the back and have them upright on the pews as if they were actually sitting there for the service, just to show more support for the family.
People can also use their live streaming options for visitation or chapel services. They are also offering virtual grief support groups in place of in-person meetings.
We're just kind of taking this day by day along with everybody else. So we'll still, keep brainstorming new service options to provide for families.
For the 9, Tiffany Huertas.
Porter Loring is not alone with these changes. Mission Park Funeral Chapels and cemeteries also offering live streaming and services like drive-through visitations and online memorial books. Since this past weekend, local officials have been releasing more detailed information about Bexar County COVID-19 cases. They've even given the public access to this dashboard with live updates. It breaks down confirmed cases by age and maps out the zip codes where people have been diagnosed. The brighter red on the map signals zip codes with more cases. The gray and tan markings show zip codes with 0 or fewer than 4 cases. One thing we're seeing is fewer cases on the south side. We spoke with 2 councilwomen representing Southside districts about why. They both brought up lack of means and access as possibilities.
So I think that a majority of the folks in my area don't have access to health care.
I think it's access to insurance and or cost of how much the test would be.
The San Antonio Metropolitan Health District says it's too early to make assumptions on why there are fewer confirmed cases on the south side based on the data they have. And if you don't have insurance, you can get a free test through Metro Health, but you need to call their hotline or 311 to make sure you meet their criteria. Well, obviously, this is a stressful time for everyone, but that anxiety is heightened for people who have life-threatening diseases like cancer. Doctors are adjusting their systems to make it safer for those patients to get treatment. But that's only one piece of the puzzle. A local cancer patient told me today she's trusting her community with her life.
In September, Juanita Gray was diagnosed with breast cancer.
I did chemotherapy up until January the 14th.
Okay.
I had surgery February the 20th and had a radical double mastectomy.
And next week, she starts radiation every day for 5 weeks at UT Health San Antonio and MD Anderson's Mays Cancer Center. The center overhauling services to keep patients safe, in part meaning Gray won't sit in a waiting room.
Patients who are waiting for radiation therapy wait in their car, and then when it's time for them to get their treatment, we give them a text, and then they're guided into a door that goes straight into radiation therapy.
Center Director Dr. Ruben Mesa says that's one of the many measures.
All of our faculty and staff who are not directly involved with patient care that day are working from home.
They're using telemedicine for many consultations and follow-up appointments, and for necessary in-person appointments, they're screening both staff and patients. Gray isn't allowed to have visitors with her, but she knows it's a change that could save lives. She's pleading with the public to understand that.
They could potentially kill me.
Yeah.
I could get the virus and I don't have the immune system that I had before because the chemotherapy took all of that away, trying to kill the cancer that I have.
Yeah.
And so if they don't take it seriously, I could die.
She loves San Antonio and is keeping the faith that people will think of her and those like her when they're following COVID-19 guidelines.
After radiation, Juanita Gray will continue infusions for about a year, and then hopefully by then she'll be in remission. And we wish her the best. Let's turn now to tonight's 9 at 9. Rapper Nipsey Hussle being remembered on the 1-year anniversary of his murder. A man facing charges after leading police on a chase while teaching his dog how to drive. Plus, a roundup of how the pandemic is affecting communities across the globe.
Here's tonight's 9 at 9. The governor of New York, the epicenter of the coronavirus outbreak in the U.S., says the state has still not reached its peak. And Governor Andrew Cuomo says it's unclear when it will.
We have literally 5 models that we look at. It's true to say almost no 2 are the same. The range on the apex is somewhere between, let's say, 7 to 21 days. If you look at all 5, it's 7 to 21 days from now.
Meanwhile, the governor's brother, CNN anchor Chris Cuomo, has tested positive for COVID-19. He still plans to anchor his show from home. Cuomo was most recently at CNN's offices in New York last Friday. This is the 3rd case of coronavirus involving those offices. The majority of CNN employees have been working from home for several weeks. The German town of Jena is the first in the country to require every single person to cover their faces and mouths while in public. A grassroots initiative in the town has started to sew masks that will be donated to entities that need them. A cricket stadium and a sports complex in a city in northern India have been converted to temporary jails for detaining those who violate the COVID-19 lockdown. About 600 people have been detained so far. Friends and family are remembering rapper Nipsey Hussle on the 1-year anniversary of his death. He was shot and killed outside of the clothing store he owned in Los Angeles. He was 33 years old. Today, fans are using the hashtag #TheMarathonContinues, which was the name of his famous 2011 mixtape. The Netflix series Tiger King has prompted new leads in the 1997 disappearance of Jack Donald Lewis. The docuseries centers on a murder-for-hire plot targeting big cat rescue owner Carol Baskin, who was married to Lewis. Now, Hillsborough County, Florida's sheriff says the show has generated new interest in the disappearance, and he's getting about 6 tips a day. A man convicted in the murder-for-hire plot has repeatedly said Baskin killed her husband and fed his body to the tigers at her animal rescue center. Baskin has denied any involvement in the disappearance. A man's been arrested for reckless driving in Washington state after a high-speed chase. During that chase, the man's dog was in the driver's seat as he steered. He told police afterward he was teaching his pit bull to drive. The chase reached speeds of 109 miles an hour. Troopers eventually used spike strips to stop the car. The man is facing multiple charges, including driving under the influence. As for the dog, police say she was taken to an animal shelter. Families across the globe are feeling the effects of COVID-19, and here at home, in an effort to help our community, the San Antonio Food Bank hosted a mega site distribution at the Alamo Dome.
Probably got $500,000 worth of food here. When this thing starts, we're going to go through $500,000 food in about 2 hours.
There's another mega site distribution event happening this Friday, but you have to register for it. For information on how, go to the San Antonio Food Bank's website. The pandemic forces a Chicago couple to get married via video conference. Coronavirus restrictions forced Dan Kramer and Linda Feldman to change their wedding plans. So they set up a video conference with a rabbi, a priest, musicians, friends, and family.
Not even a global pandemic could keep you from declaring your love for each other.
The bride's family even had a wedding cake delivered to the happy couple. To read more about these stories, head to KSAT.com.
Hey guys, good evening. I hope you had a wonderful Tuesday. It was absolutely beautiful outside. I'm meteorologist Sarah Spivey. Gonna take a look at the next few days. Tomorrow's gonna be beautiful, but I thought we'd start our forecast here with some good news, some much needed good news. Now I'm showing you the pollen count right now, and while oak is still high, past 3,000, it is way down from yesterday. Yesterday, oak was almost at 31,000, so we are seeing some improvement there, so that is good news. Mold has gone up a little bit from yesterday's rain, but it's still only moderate, and of course we've got mulberry, pecan, hackberry. They're all low, which is, again, good news. So some good news there, and like I said, the weather was beautiful today. We actually saw a high temperature right near 79, which is pretty close to average, and our morning low was spot on 54 degrees. Tomorrow morning, though, it's gonna be even cooler. In fact, with clear skies and relatively calm winds, we're gonna see temperatures plunge into the upper 40s up in the hill country. So areas like Bernie, Kerrville, even as far close as San Antonio's Leon Springs, going to be seeing a morning low in the upper 40s. Here in San Antonio, we'll be right around 52 degrees. It's going to be a beautiful start to the day tomorrow. So if you have any plans to spend some time outdoors, do it early in the day, in the cool of the day. It's going to be very nice. Then tomorrow, for your Wednesday, we'll have mostly sunny skies, low humidity. Another day where the high temperature will be awfully near 80 degrees, but feeling great. Southeast wind at 5 to 15 miles per hour. Now that southeast wind is going to slowly increase humidity. You won't feel it tomorrow, but by Thursday, we'll start to introduce a chance for rainfall. In fact, a 30% chance for rain on Thursday. But Friday, Saturday, and Sunday, we're gonna see scattered showers and a few rumbles of thunder as well. All in all, this weather pattern over the next several days is going to be very spring-like in nature. And what I mean by that is after tomorrow, and there will be a chance for rain every day, but also there will be a chance for some stronger storms as well. Very spring-like in nature. We are in the thick of spring, so as always, with the weather changing and being different every day of the next 7 days, make sure you have your KSAT Weather Authority app downloaded on your phone. It's really neat. We'll be able to send weather notifications right to your phone. So that's it for the weather right now. Hope you guys are staying safe and healthy at home. Enjoy that beautiful weather tomorrow. Rain chances in the forecast after that.
Thank you so much, Sarah. Stick with us. We'll be back in a minute.
Welcome back to the News at 9. We are continuing our effort tonight to fight fear with facts as the coronavirus pandemic continues to impact communities across the globe. Infectious disease doctor Dr. Ruth Berggren from the Long School of Medicine at UT Health San Antonio is back with us this week to help us get answers to our coronavirus questions. And right off the bat, I want to talk about something that we didn't get a chance to get to at 6 o'clock, Dr. Berggren, and that's the clinical trial on a COVID-19 treatment that is being studied right now at UT Health San Antonio.
Well, Steve, that news is one of the bright spots of our week. We're all very proud of our colleagues at the Health Science Center that have stood up this trial. We're looking at the drug called remdesivir. It is an antiviral drug that has been used in humans for various reasons, but has not yet been FDA approved. And it inhibits the replication of the coronavirus at an early stage in viral replication. So the clinical trial is being done at 75 different sites across the country. They're looking to quickly enroll about 440 people. That's all told. And this trial will tell us really how effective remdesivir is. And so we're very proud to be able to offer that to patients who are eligible for it at University Hospital. There's another site in the city, I believe at BAMC, that is also offering this trial. And to date, we have 6 people that I'm aware of that have been enrolled and possibly another one tomorrow. So we should be learning soon, in a matter of weeks and certainly months, whether remdesivir is a hopeful treatment with good outcomes for coronavirus.
Yeah, that is a bit of good news in the midst of all of this. Another thing I want to talk about is when we talk about flattening the curve, are you seeing signs at all that that may be happening or projections that that may be happening in San Antonio and South Texas?
So the numbers that are rolling in over the last few days are causing us to become cautiously optimistic that the curve may in fact be flatter. We are not New Orleans, we're not Detroit, we're certainly not New York City. We're not seeing the skyrocketing numbers of cases. You know what those numbers are. You know that we've had already too many deaths here in San Antonio, but we don't seem to have runaway epidemic. And I think that is evidence that these social and physical distancing measures really do make a difference. And what it means is now we have some data that can be plugged into various models, and I've looked at several of those, and I've seen estimates that the peak of our outbreak could happen in late May, early June, and even another one, and that would be for Texas. And I've seen another model suggesting that our peak might not come till July. And I believe that sounds like a long time, and I appreciate that. But the good news is the height of that peak is so much lower than it otherwise would have been that we can reasonably hope that we'll be so well prepared that when we do have that surge, the number of cases that need ventilators and ICU care will not exceed our capacity. And that's what we're working so hard to ensure, is that when we do see our surge, our hospital and our healthcare workers are not completely overwhelmed.
Are you happy with how the city and the county officials are working together to make sure everybody is ready for when that surge comes, if it's in 2 weeks or in 2 months?
I have to say that I really am proud of San Antonio. We're known for teamwork, right? The Spurs, one team, one dream. And I have been involved with the county. I see the county working with the city. There is the South Texas Regional Advisory Council, the Emergency Operations Center, Metro Health, the chief medical officers of all of the various hospitals, people coming together, having regular meetings with committees on various aspects of this emergency response, helping each other, guiding each other to resources, collaborating on testing. And it's incredibly complex, and we can drop the ball sometimes because we're human beings, but there's such goodwill and there's such an intensity of focus that I feel very proud to be part of this city's response.
Are you seeing a problem at all with people hoarding medicines? I mean, we've heard a lot about the run on toilet paper, the run on paper towels and bleach and disinfectants. Are you hearing or are you concerned about people hoarding medications?
Well, I know this is the case because this afternoon I was conducting a telemedicine clinic and I needed to order the drug azithromycin for one of my patients who needed it for his HIV care. And I was told by the pharmacist at CVS that they were completely out. And I had to wind up finding an alternative dosing schedule for this patient. And that never happens. We don't run out of azithromycin in this city. So that simply means to me that people have been prescribing large amounts of azithromycin, perhaps anticipating, and that means that drug isn't available for others who need it for other reasons. We know this is happening for patients with lupus. We've had family friends that are posting on Facebook, I have lupus, I can't get my hydroxychloroquine prescription filled because there are stockouts. And so this is really not justified, and we need to not have people storing and hoarding medications that they don't need, because it makes it impossible for us to treat people who really need it for a variety of reasons, not excluding people that are in the hospital that can't get on the remdesivir trial, that we need to have something to treat them with.
Right, and the two medications that you were talking about are medications that have been rumored to help fight COVID-19, but have not been proven to fight COVID-19, correct?
They've not been proven. To say that it's rumor is not quite right. There are non-peer-reviewed reports in non-peer-reviewed medical literature that give some indication of potential benefit. But these drugs also have side effects, and they have serious side effects when used together. They can lead to a heart arrhythmia, and they should not be used outside of a physician's supervision. Yeah. And we have very strict and specific guidelines for how these medicines should be used, if at all.
Yeah, so that's a big concern for you, that people are using those medications and maybe shouldn't be.
Yes, it is. I think people are using them willy-nilly without a physician's supervision. They are at risk of having toxicity to their heart, overdoses, drug-drug interactions, and also preventing people who really need these drugs for other reasons from having access to them.
Final question for you. How do you take care of someone who is sick and may or may not have been diagnosed with COVID-19?
So let's say that this person has signs and symptoms that are strongly suggestive. So the fever, the sore throat, the dry cough, even a little bit of breathlessness, whether they are waiting to get their COVID test back or whether they were simply told by their doctor to presume that they have COVID and go home and stay home, they need to not just quarantine, isolate themselves. That means that in the home, that person needs to be kept taken care of in a bedroom that's separate from other people, if at all possible. They need their own bedroom. In homes where it's possible to have your own bathroom, they should have their own bathroom. When they're in there, they need to have the door closed, and they should only have one person in that family or in that household providing care. When that person comes in to provide the care, they should put on a mask. And ideally, if it's possible, the patient who's being cared for should put a mask on as well. Gloves are a good idea for the folks that are providing the care, especially when they go and clean up after the sick person. And of course, careful removal of those gloves and meticulous hand washing for the 20 seconds that's recommended is really, really important. So when the person starts to feel better and they want to come out of their room, they should put a mask on, and they should practice the social distancing guidelines, even in their own homes with their own families, to protect the others. And then we have specific guidelines for when it's safe to go back out into the world. And you need to have been home in isolation for at least 7 days from the start of your symptoms. And then after that 7 days, you have to have had 3 full days, 72 hours, with no fever, and certainly a reduction of your symptoms. So if you can meet those criteria, you've been out of circulation for 7 full days since you got sick, and on top of that, you've had 72 hours with no fever and your symptoms are diminishing, then you can go out and about. There may be some people that after fulfilling those criteria are still coughing. You know, all of us, when we get colds, sometimes we cough for weeks and weeks. That could happen. And if you are one of those people and you fulfill the criteria, but you're still coughing, you should wear a mask when you go about in public.
As always, for the 3 weeks that you and I have been having these conversations, I'd like to give you the last word, and I want to do that tonight. What do you want to leave our viewers with on this Tuesday night?
So stay home, work safe, save lives. And remember, we are San Antonio. We're working together. We're a team, just like the Spurs. One team, one dream. What's our dream? Our dream is flattening the curve and saving lives. Thank you, Steve.
All right, Dr. Ruth Bergeron from UT Health San Antonio, thank you. We'll be right back.